This is a story about how my patient with aggressive multiple sclerosis recovered well enough to beat me in the Los Angeles Marathon. Now, I'll be a little bit discreet for obvious reasons. I met this person in their 20s, and they had very aggressive relapsing multiple sclerosis. By the way, I'm in Carlsbad, California, walking around the hotel. I took my kids to Legoland this weekend, and they're still asleep, so I'm taking a morning walk. So anyways, most people, when they're younger, they have relapsing MS, their symptoms tend to be fairly mild at the outset. There's a large correlation between multiple sclerosis and absolute age, time since birth, where younger people are more likely to have relapsing MS. They might have optic neuritis, pain and vision loss in one eye, but they walk normally and they don't have major problems at the time of diagnosis. Older people are more likely to have progressive MS and have significant problems even at the time of diagnosis. This was a younger person in their 20s. And when I saw them, they were already walking with a walker. They had a lot of tremulousness, imbalance, weakness of the legs, numbness, and couldn't get around so well. And this does happen sometimes. Now, their MRI scan was very impressive. It's not uncommon for people with relapsing MS to have gadolinium-enhancing lesions. These are lesions where when we give the gadolinium contrast dye, because there's active breakdown of the blood-brain barrier, the dye gets out into the brain and causes the lesions to enhance. And someone might have one or two enhancing lesions. People who are asymptomatic, not having a relapse, can also have active lesions, which is the reason for doing screening MRI scans in people with MS who are doing well, particularly people not taking disease-modifying therapies or highly effective disease-modifying therapies. This person had approximately 50 enhancing lesions on MRI scattered throughout the brain. Relatively little in the spine. And this is a lot, not something we see on a day-to-day basis, but it can happen. And of course, people with relapsing MS improve all the time, and certainly many people with MS have been in wheelchairs and recovered and been able to walk, but usually not to the point where they can run marathons. And so I saw this person, and they were treated with steroids. And, for people who aren't recovering well with high-dose steroids, there are other treatments. Sometimes we'll give people plasmapheresis, a dialysis-like procedure, which removes antibodies and cytokines, and that can be effective in people who have severe relapses that don't respond to steroids. But for people with very aggressive relapsing MS, there's some other things that we can offer, and one of them is chemotherapy medications. And so this person took a medication called cyclophosphamide, Cytoxan. And this is an old medicine. It's been used in MS. It's been studied in MS. It's long been generic. It's used to treat various forms of cancer and other autoimmune diseases like lupus nephritis. And it definitely works. We just don't use it all the time because it's very toxic. It doesn't cause a lot of hair loss, it doesn't cause a lot of gastrointestinal side effects, but it can definitely cause hair loss, it can definitely weaken the immune system, and it has some specific side effects like inflammation of the bladder, hemorrhagic cystitis, risk of future cancer, including bladder cancer, and potentially even infertility. So for a young person, especially someone who wants to have children, it's something you definitely have to think about. It's not something we're going to give to everyone, and it's not really sustainable as a long-term treatment. Now, the same drug is used by some people with hematopoietic stem cell transplant, but at much higher doses. And so we might use a dose such as 1 gram per meter squared, monthly for 6 months intravenously, which works out to maybe 2 grams in an average sized person. But in hematopoietic stem cell transplant, they might use doses such as 200 milligrams per kilogram total divided into multiple doses, which is going to work out to a much, much higher dose. And of course, that's why they give people transfusions in order to help recoup their immune system. But both regimens can be effective. And with doses like 1 gram per meter squared, you don't have to give a blood transfusion or any other restorative therapy, because it generally would not ablate your natural bone marrow's ability to produce red and white blood cells, although there's definitely a risk of infection. And so anyways, this person agreed to go forward with this therapy, and they were improving. And maybe the next time that I saw them, they were no longer walking with a walker, but still very imbalanced, still not walking normally. And they were just steadily improving, and I figured at a certain point that's all we were going to get with Cytoxan. We were kind of beyond the active phase of the disease, and I transitioned them to a more standard disease-modifying therapy just to prevent future attacks. Now, the thing about Cytoxan is it's not just good at preventing future attacks. We think when someone has active lesions, it actually gets past the blood-brain barrier and is good for active inflammation and may potentially help someone recover from a severe acute attack. That's the justification of this treatment. And so anyways, they were slowly improving, they were stable, and so I considered it to be a win. And I hoped that this person would be stable going forward, certainly had some existing disability, but they would be able to live a decent life. But this person just continued to improve. Slowly, steadily, over years, really. A lot of the improvement was over 6 months, but they were still kind of moderately disabled after 6 months. But after a year, they were doing a little bit better. And of course, they were doing physical therapy, but at a certain point, physical therapy ends, and you just sort of incorporate some of the therapies into your lifestyle. And this person was sort of walking, exercising, eventually went back to work. And then later on, they were getting even better, and they told me, I started running. I started running for exercise, and I thought that was great. And, they continued to have abnormal signs on the neurological exam. A little bit of numbness in the extremities, a little bit of tremor, but it didn't seem to affect their running too much. They were still able to do it. I mean, it must affect them a little bit, but maybe not as much as you would think. And so I encourage them to continue to exercise. Now, some people with MS, they can't really do that form of exercise. There's this phenomenon where people may be okay, like they can walk well, but with intense exercise, the increase in body temperature sort of worsens the symptoms, and it's very hard to do this form of intense exercise. And back in the day, there was even a myth where you should discourage people from exercising and discourage people from doing other things that would raise body temperature, like going out on a hot day or going into a hot tub or taking a hot shower. Of course, this is all nonsense. It's not like heat worsens the disease MS. It just often worsens the symptoms of MS temporarily, but it's perfectly safe to do any of these things if it doesn't bother you. From a practical perspective, some people can't do intense exercise because they'll feel horrible, but this person didn't seem to bother them, so I encourage them to continue to do it. And there's this thought where you can improve from an MS relapse for 6 months, maybe a year, but that's pretty much it. That's as good as you're going to get. But it's not really true. In some people, there's a possibility of slow improvement over several years. And I have seen that multiple times, actually, not just in this individual. And that's what they experienced. They continued to slowly get better and better and better. Their exam was always abnormal to this day. But they've been stable. A lot of their active their active lesions kind of shrunk down, but they're still left with a decent amount of scar tissue there. MRI is still abnormal. Exam is still a little bit abnormal. But anyway, this person told me that they were going to train for the LA Marathon. And, I encouraged them to go for it. Now, back when I was young and fitter, of course, I blame any decline in fitness on my kids. I've actually run the LA Marathon 4 times. And my best time is 3 hours and 51 minutes. And, this is not like a competitive time, but, it requires training for the average person to achieve. And back in the day, I used to run 40, 50 miles a week at the peak of my training. It's about 8 hours and 50 minutes per mile, and a marathon race is 26 miles, 385 yards. And for me it was a pretty good time. I'm definitely not an athlete, but I trained hard for it. And so this person actually completed the race, and they followed up with me, and their time was actually significantly better than my time. And I couldn't believe it. It was a very impressive time. And by the way, for people who are skeptical, there are ways to verify people's running times and checking their split times. And I promise you, this is 100% legit. And I just couldn't believe that someone could have such severe multiple sclerosis. I mean, we're talking like 95th plus percentile in severity for a younger person with relapsing MS, and recovered enough in order to actually run a marathon at a really good time, a very impressive time, even for someone without multiple sclerosis. Now, obviously, not everyone is going to achieve these results. This is a rough disease, and there's some element of luck here. Maybe this person just didn't have that much damage to their central nervous system. Maybe some of the symptoms at the beginning were kind of stunned tissue due to edema or swelling around the lesions, rather than permanent damage to the underlying nerve fibers. And so, I certainly can't take the credit for it, and maybe even they can't take 100% of the credit for it, because there's a little bit of luck here. But it's definitely possible for people to make incredible recoveries from relapsing multiple sclerosis. And even with progressive multiple sclerosis, I have seen some people make significant improvements. It's less common, but it can happen in some unique cases. And so, I make this video just to maybe encourage someone, particularly someone with relapsing MS, dealing with a new diagnosis or a bad relapse, that you might be able to recover more than you think over a long period of time. And so it's definitely worth it to try to work with physical therapy, try to do whatever exercise you can, and hope to get better over time. And I'd be interested to know if any of you have had a bad relapse. What were your symptoms like, and how much were you able to recover, and what did you do to get better over time?